And I've listed here just some common neurotransmitters, which you're all likely familiar with. We've got adrenaline, which is our fight or flight neurotransmitter, dopamine, which is our pleasure, our happiness neurotransmitter, serotonin, also a neurotransmitter involved in mood states, glutamate for memory, acetylcholine, um, often seen in the literature denoted as ACH. Involved in learning and memory, are endorphins for euphoria, and then GABA or gamma amino butyric acid, which is a calming neurotransmitter. So this is the one that's kind of like brakes on a car. And I've also included this picture just to remind people of how much overlap that exists, right? So, anxiety and depression often go hand in hand. So, all of these various mood and cognitive states have various overlapping contributions of various. So, the tricyclics or the TCAs, these are the oldest class of antidepressant medications. You will usually recognize them because they end in things like amine and apine. Um, these are considered dirty drugs. So many receptors are affected. There's a lot of possible side effects. They're extra dangerous and overdose, so we avoid giving these to patients with past overdose attempts or thoughts of suicide by overdose. Because TCAs are toxic in overdose. They have a therapeutic window of 7, meaning you only have to take 7 times the normal amount to potentially cause death. And these are some of the ones that you might recognize: Elavil or amitriptyline, anafranil or clomipramine, tofranil or imipramine, Cinequan, doxepin, or Ascendin, amoxicillin. A few other things to note about TCAs is that it's important. So, of course, for both categories, again, equivalent efficacy. But here is a list that helps break down some of the differences in terms of the side effect profile. So, first generation, you tend to see the neurological side effects, decreases in dopamine, no real effect on serotonin. Second generation, less neurological side effects, but more metabolic side effects. Also decrease dopamine, but here we see an increase in serotonin. So in the spirit of time, I'm going to keep coming through these, but just again, another helpful mnemonic for you to remember some things about the psychotic medications. So EPS, or extrapyramidal side effects, neurologic or motor symptoms that occur in the context of antipsychotic use. They tend to occur, like I said, with the use of first generation as opposed to second. So why don't we give it to everyone? It pays for its incredible effectiveness with a really harsh side effect profile. So one of the lowest therapeutic indices known to man. It means that the dose necessary for effect is very uncomfortably close to the dose that will hurt or potentially kill someone. So remember the mnemonic LMNOP for the side effect profile. So L is for lithium. M is for movement. So one of the earlier side effects that might be seen in lithium use is tremor, often found in the hands. N is for nephrotoxicity, so referring to the kidneys. O for hypothyroidism. The most common complication of long-term lithium use is baseline TSH is, lowers because of that as a side effect of that medication. And then P is for pregnancy. So it's a known teratogen. So LMNOP to help you remember.